Okay, one of the other misconceptions about psychotherapy or counseling is that when someone comes in to see a counselor or a psychotherapist, that they're going to come in and see the psychotherapist or the counselor, and they're going to lie on a couch, and they're going to talk about their childhood back to when they were an infant. Whereas that does actually happen, mostly in psychoanalysis, that is not usually the case with psychotherapy. So we are not going to get you to regress all the way back to your childhood days and tell us about, when you had your first puppy or when you had your first teddy bear or anything like that. What psychotherapy does is it deals with your problems that you're experiencing right now today. So if you're experiencing problems with your wife or your husband or your adult children or your co-workers at work or your neighbor or whomever is causing you distress, maybe it's a sibling or something, what we do is we talk about the problems that you're having right now. We don't go back into the past. Now, that having been said, a lot of times what will happen is when people will start to talk about the problems that they're experiencing now with their wife or their husband or their adult children or with their coworker or with whoever they're interacting with, they will begin to start to notice a pattern. So they will start to notice, I've had this pattern, I've had this same type of interaction with my boss that I've had with the boss that I had before, and with the boss that I've had before, and with the boss that I've had before that. So people start to notice a pattern. And then when we dig deeper, they start to go further and further back, until eventually what does sometimes happen is people then eventually do go all the way back into their childhood and start talking about some of the first interactions they had where this type of interaction was problematic. So we start with the problem is right now. And sometimes it can be solved right where it is. We don't have to go all the way back into the past. However, when patients start to explore what's happening in their present, they are often, but not always, sometimes led to what has happened in their past. And so they gravitate back there naturally.